Hi, good morning, afternoon, evening, everybody. Welcome to this session 22 on results, frameworks and adaptation of existing methods for COVID-19 focused M&E. My name is Sam McPherson and I'm a partner at ITAD. I have great pleasure of moderating the session coming up. Really interesting session, some great speakers and hopefully plenty of time for Q&A, which I'll be moderating in due course. So I'm going to hand over immediately now to Marc, our lead presenter, who's going to talk through the presentation and make the key points, and then my job will be to then introduce the panelists and open up the Q&A. So without further ado, welcome, and Marc, over to you.
Thanks very much. Thanks, Sam. Hi, my name's Marc Theuss. I'm the Director of the Quality of Life Monitoring and Evaluation and Research Technical Support Unit at the Aga Khan Development Network. And in session 22, we're going to be looking at results frameworks and adaptation of existing methods for COVID-19 focused M&E. Next slide, please. So the key takeaways for today's session are that COVID-19 has created barriers to traditional M&E, which have required that organisations like AKDN have started to use technologies and methods to generate evidence and insights in new ways. And often that process of being forced by the constraints involved in undertaking M&E at a time, during the time of COVID-19, has been a powerful driver for us to innovate and to find, to use methods and approaches which have strengthened rapid feedback loops to decision makers and improved course correction, which has improved kind of our approach to programming. We've had some really interesting experiences over the period of the COVID-19 pandemic of using technologies, apps to support behavior change and appropriate health treatment seeking behaviors, but also using those apps as a technology for engagement for data collection. And that process has demonstrated to us within AKDN that use of new technologies and increased feedback loops to decision makers allows us to make decisions more rapidly and more effectively. We've also had some interesting experiences within AKDN of localizing M&E through leveraging networks of local volunteers, which has provided powerful opportunities for us to generate richer evidence and insights during the time of COVID-19 when it's been difficult for professional M&E teams to get access to the field. And in addition to all of the panelists that are here today from AKDN, we also have one panelist from an organization called 60 Decibels, which has powerfully combined new technologies, remote data collection, and routine engagement processes to promote uptake and greater utilization of evidence. And in this session, we're going to be talking through some illustrative examples that capture those takeaways to provide a kind of a richer kind of understanding of those takeaways. And then we're going to be handing over to the panelists that are going to talk through those examples and additional points in more detail. Next slide, please. So this session around results frameworks and adaptation during the time of COVID connects to the theme of evaluation to support innovation, because the key takeaway we're making is that COVID-19 has forced adaptation in methods and approaches, which has led to improved course correction and programmatic change and innovation. Next slide, please. So I'm going to start off with talking through some examples of our experiences during the COVID-19 period and prior to that from an AKDN perspective. And just to give you a bit of a background, the kind of goal of the Aga Khan Development Network is to improve the quality of life within the communities that we serve. And the key way that we historically have measured quality of life is through something called the quality of life assessments, which are mixed methods assessment approach, which capture kind of processes of change and quality of life and domains of quality of life over time within the geographies that we focus on. Next slide, please. So just to give you a bit of background to this goal, the quality of life of AKDN and the key domains that we think are key enablers and facilitators of quality of life, I just wanted to give you a definition of quality of life. So we understand within AKDN a person who has a high quality of life to be a person whose basic needs are met, who can act effectively and meaningfully in pursuit of his or her own goals and feels satisfied with life. So we try periodically in each of our core geographies to measure changes in quality of life and the contribution of AKDN in achieving quality of life. But we also look at a whole set of domains that we think are enablers of quality of life. And they include household economy, habitat, health and education, social and cultural life, and voice and representation. And we try and understand our contribution to those changes and the general changes in general through a mixed method assessment approach. So a large household survey and a qualitative research process that involves face-to-face data collection. Next slide, please. I just wanted to take you through some of the key questions that the quality of life assessments address. So within the context of the assessments, we look at, are the pooled efforts of AKDN agencies and their partners influencing positive changes in the quality of life of a given area's population? Are we as AKDN doing the right things? Over time, are indicators getting worse or better in a given place, and why? And what are the kind of key areas within that framework, that quality of life framework, that we can realistically influence within a particular time frame? And the idea is that the quality of life assessments are kind of rigorous and comprehensive. They're based in kind of methodological rigor, and they provide kind of an evidence base for long-term strategic decision making. Next slide, please. So, of course, when COVID-19 pandemic became kind of an important factor in AKDN and all of our working lives and lives, we realized that the quality of life assessments might not be the right methodology for understanding the effect and the contribution of AKDN at that particular point in time, and for at least a year or more. And we started to work as a network very much around a COVID-19 response, and accordingly we started to adjust our results frameworks and our monitoring and evaluation approach to that new COVID-19 response. And so I just talk you through the key pillars of the AKDN COVID-19 response before I start going into the M&E side of things. So the first pillar within our COVID-19 response was to slow and stop transmission, prevent outbreaks, and delay and suppress the spread. The second pillar was provide optimized care for all patients, especially for the severely and critically ill. And third was to minimize the impact on communities, on the vulnerable, and social services and economic activities. Next slide, please. So I just wanted to give you just a taster of the results framework that we developed within AKDN to kind of measure the effects of the outputs and effects of our work in relation to the AKDN COVID-19 response. And here you've got some of the kind of indicators and some of the results framework for pillar one. And what we tried to do was to kind of like start with a question that we were trying to answer to make the kind of indicators and the results framework as utility focused and as user focused as possible. So for instance, are people receiving information about COVID-19, including risk factors, symptoms, and prevention methods? And kind of the indicator linked to that was number of public awareness messages shared related to COVID-19, number of people reached with messages related to COVID-19. So as you can see, we've made quite a big transition from the quality of life assessment methodology, which was quite high level goal and outcome level, to something that was quite output level focused, which we felt was important if we wanted to collect data quickly and feed that back into kind of decision makers for course correction and to understand the effect of our work quickly. Next slide, please. And instead of creating kind of reports and kind of quite sort of rich but exhaustive kind of engagement products, we really tried with the COVID-19 response results framework to do things in a way which would allow for quick decision making, quick feedback loops, and quick course correction. And so we basically visualized everything on dashboards. And this is just an example of one of the dashboards that we used for pillar one, just to give you kind of an illustration kind of how we tried to engage with decision makers. Next slide, please. So I'm just going to start going through a few examples of some of the monitoring and evaluation related work that we've been doing during the COVID period. And then we've got panelists here who are will be able to speak in much more depth to some of these examples that I'm going to provide. So I'm going to start first with an app called Corona Check, which has been developed by AKDN. It's the core kind of focus of Corona Check is to fight the spread of COVID-19 through digital health technologies. Next slide, please. So this is the Corona Check mobile app. So the Corona Check mobile app was devised to support the government's effort at curbing the spread of the virus. The AKDN developed and launched Corona Check, a mobile application that allows users to conveniently and safely conduct self-assessments at home and increase their awareness regarding COVID-19. The app's primary aim is to reduce health facility burden by reducing hospital visits and ensuring diagnostic testing in health and diagnostic testing in health facilities is only undertaken to ensure those most at need. The innovation also aims to engage and empower individuals and communities in target areas by providing COVID-19 related information and access to health and social services in order to reduce the spread of COVID-19 and improve the availability and accessibility to care. So Corona Check is based on artificial intelligence, and it offers three kind of core elements. One, a self-assessment tool. Two, it raises awareness through educational videos, which are translated into local languages, and it also promotes behavior change. It's interactive, and it allows people to recognize symptoms and recognize whether they've contracted COVID-19 and to seek help in a timely fashion. Next slide, please. Here's some kind of, here's a slide that looks at kind of the number of users, the self-reported surveys of data collection within Corona Check. And here you can see that 3 countries have, the Corona Check's been rolled out in 3 countries. And I'll just talk through some of the kind of what this slide tells you. First of all, the analytics that sit behind Corona Check reveals that 24% of the users who attempted the survey were suggested to seek immediate medical care. That's Plan A. While 28% of people were advised to seek non-urgent care through teleconsultations without visiting a health facility. That's Plan B. And 48% were advised to only take precautions and social distancing. So that was Plan C. Overall, the app was able to help prevent unnecessary hospital visits in 76% of cases, curbing the risk of spread, whilst ensuring that diagnostic testing in health facilities was only availed by those most in need. The remaining 24%, the app helped reduce harm, risk, and spread of COVID-19 by directing high-risk patients to seek immediate medical attention. Next slide, please. Here's a slide which presents the number of people that used education, that consumed educational visits by country. And those videos captured topics around COVID-19, symptoms, precautions, and physical distancing. And these are the number of video views between April and August 2020. Next slide, please. So I think the key point that I'd like to make with regard to Corona Check is that Corona Check both supported kind of a process of behavior change for people that were worried that they had symptoms of COVID-19. It provided an opportunity for AKDN and the broader health system to ensure proper utilization of services for those most at need. And it also was used as a product within the Aga Khan Health Services Pakistan as a screening tool when they were doing calls on when they were doing calls with people that were wanting to screen for COVID symptoms. But also it was an engagement platform that allowed us to collect data to feed back into decision makers for course correction and improved decision making. So it had that dual kind of function, both behavior change and also as an analytical tool that allowed for better course correction and decision making. Next slide, please. I'm now going to go over to the example of Aga Khan Foundation India. Tinni in our panel is going to be able to provide some more examples of that. And I think that this is really a story of an AKDN agency within a particular country going through a transition from a kind of traditional approach to M&E to one that was kind of tailored and better equipped to deal with the kind of COVID-19 pandemic situation. And as a result, I think the experience of AKF India was that that led to better kind of decision making. It led to a more engaged kind of programmers' engagement with evidence, and it led to more timely decision making. Next slide, please. So prior to COVID-19, AKF India's approach to M&E consisted of in-person data collection. They used questionnaires, focus group discussion, interviews, etc. And the kind of protocols that they tended to use were, external evaluations using a baseline, midline, endline type approach. They would use kind of like a project monitoring approach, looking at the activity and output level. And they never considered access to communities a challenge. Their main approach would usually be a face-to-face data collection approach, though in some cases they did try digital remote-based surveys using kind of lean data, our colleague here, Tripti, who's on the panel, will be able to talk a little bit more about the lean data approach within the conversation and the Q&A. Next slide, please. Then during the period of COVID-19, there was a lockdown in India that was quite a strict lockdown, and access to communities became an issue. For AKF India, a key priority became designing the programs and adapting programs to be more responsive to community needs at the time of COVID-19. And at that time, AKF India made the decision to do their first initial phone survey, that was in April, to understand kind of the status of communities within the core geographies that they served. The telephone interview that they implemented was based on a survey that had both open-ended surveys but also closed questions. And the kind of key respondents that they focused on were household representatives, frontline workers, health and sanitation workers, and school teachers. And I think the key really positive learning from that was that they generated really useful insight through that process. And they were able to generate evidence very rapidly and in a timely fashion, which could feed into kind of a process of design to address the key issues faced within the COVID-19 era. However, and that kind of contrasted, I think, quite starkly with their experience of doing M&E prior to COVID-19, where often there would be an extended process of an evaluation that would then take quite a long time to feed back to decision makers, and then often the world had moved on to such an extent that maybe it wasn't as useful as it could, the evidence wasn't as useful as it could have been. However, of course, there were some challenges associated with that experience. AKF India found analysing open-ended questions difficult. They found also from a gendered perspective that often the respondents would often be male because they had access to mobile phones as head of households. So sort of accessing women was an issue and was a challenge, and also kind of different age groups was also an issue. Next slide, please. After that April survey, subsequent surveys were implemented using digital tools and remote data collection to understand evolving community needs. So things like the extent of reverse migration, access to food rations and other entitlements, and cash liquidity. And they had a lot of experience with digital surveys called ACVO and lean data approaches, which we're going to be talking about in more detail later in this session. And I think the key kind of elements of that were compelling for AKF India was that these approaches generated quick results. They allowed multiple levels of analysis and verifiability. The key advantage was that they generated visualizations and data through dashboards and maps, which I think was a much more kind of compelling engagement output for programmers. And that really allowed for much more effective mid-course corrections in implementation. But of course, again, there were limitations with the phone survey methodology that they used. It was difficult to access women, and also it was difficult to kind of keep a regular update of mobile phones and ensure that their sampling approach was accurate and precise. Next slide, please. I'm now going to turn to the experience of the Aga Khan Agency for Habitat, particularly the Akka Tajikistan experience during COVID-19. And Hadi Husani, the CEO of AKF, of Akka Tajikistan, is here to talk in a bit more detail about this example. And the key experience here that Akka Tajikistan have had during COVID-19 was using in situ volunteer networks to support monitoring and distribution. Next slide, please. So Akka's experience was that prior to COVID-19, that donors and partners would often engage M&E teams to travel on site to review program delivery and installation. And then in the era of COVID, in an effort to stem transmission, access to project areas was curtailed. So Akka's ability to use kind of their typical M&E team, internal and external M&E professionals, was curtailed, and they tried to find a kind of different solutions to deal with that. So to ensure that donors and partners and Akka had the ability to oversee the delivery of their critical emergency assistance during that period, Akka volunteers were trained to support monitoring interventions. And also, Akka put in place kind of technology solutions to support teams to capture and disseminate the information, ensuring that safeguarding was also, procedures and steps were also in place. And then since that time, Akka has successfully engaged that network of volunteers who are using the technology platforms that have been developed quickly to generate monitoring data. And I think that Hadi will talk about that in more detail, but that's led to kind of rich insights, reliable and useful kind of monitoring data. But I think has also kind of provided kind of a platform for greater participation of volunteers within the process of overseeing the kind of program and ensuring program quality. Next slide, please. This slide just really illustrates the water purification project within which that monitoring system, that volunteer-based localized monitoring system has been implemented in across Tajikistan in partnership with JICA. Next slide, please. I'm now going to turn to 60 Decibels. 60 Decibels is an organization that AKDN has worked with on a number of occasions, and its core area of work is leveraging customer interviews to understand COVID-19's impact in the developing world. Next slide, please. 60 Decibels is a social impact measurement company. Their core kind of approach is the lean data approach to measuring impact, which is optimized for nimbleness, flexibility, and remote deployment using voice surveys over mobile phones. And 60 Decibels, I think really, they've been using new technology, they've been using remote data collection for many years now in collaboration with their partners and their clients. But I think they've really expanded and really the methodology has become particularly relevant during the era of COVID-19. And during that period of COVID-19, there was a temporary suspension of face-to-face data collection amongst research organizations, and many organizations were needed to make a shift to phone-based surveys. During that time, in the early days of COVID-19, nearly all impact data was captured via online surveys, which really emitted a large segment of the world's population, around 50% of the world's population, that don't have internet connections. So the 60 Decibel team adapted to this, and they began to implement a new approach to listening to customer voices with regard to what's happening in their lives. Next slide, please. So how has 60 Decibels responded in the time of COVID-19? Well, before COVID-19, typically 60 Decibels would implement studies over longer time periods, around 12 weeks, with quite small sample sizes within quite a reasonably small geographical area with a reasonably small kind of design scope. And now 60 Decibels are undergoing very routine data collection with results being shared on public dashboards, which are updated almost weekly. These M&E systems have a very long duration. They're ongoing processes, which include multi-country engagements with clients. These studies, these processes include like enormous sample sizes and have got a time series design element to it. So it's possible to track change over time. Also, a key part of that is that 60 Decibels are now sharing data regularly, which they're finding, through these regular updates of their dashboards, that this is boosting utilization and enabling social enterprises and funders and investors to have a data-driven response to the crisis. And so recently, 60 Decibels, during the time of COVID-19, has surveyed over 17,000 people in 16 countries about the impact of COVID-19, and that's routinely updated on their public dashboard. And a key element of that also is that they have an engagement process which involves convening key decision makers on a regular basis to engage with the data and make decisions around that. And Tripti from 60 Decibels will talk about that in more detail in the panel session. Next slide, please. So just to conclude with regard to 60 Decibels, what's 60 Decibels' goal? Firstly, it's to track the impact of the pandemic over time and equip those looking to respond. They would also want to have real-time customer beneficiary voices help inform action and support where it is most needed by identifying the most effective solutions to address the needs of being served. And then finally, another core element of their approach is trying to report in a lean way to save valuable time amongst their clients and to save money for organizations that have limited resources within our resource-constrained world and our increasingly resource-constrained world. But again, Tripti will talk in more detail about the 60 Decibels experience. Next slide, please. So just to conclude, the key takeaway for this session is that adaptation in the field of M&E, which is being required by the COVID-19 context, has led to a number of experiences across AKDN and 60 Decibels and the broader M&E arena, has led to strengthened utilization through improved rapid feedback loops, which we feel has improved decision-making within specific situations. Looking forward to the panel discussion and the Q&A. Thank you very much.
Thank you very much, Marc, and bang on time. So congratulations on hitting the time limit. I'm going to hand over to the panel now. From my perspective, I think this is a fascinating session and really helping us focus in on some concrete examples of how organisations like AKDN and 60 Decibels have actually adapted and used technology to help both M&E challenges that they're already facing, but new challenges as well, and then feed that into decision making. So really hoping we can have a good discussion from that around that from the panel. To all the participants, I want to flag that as you probably know, those of you who've been around for the sessions to date, there's a Q&A function on Zoom. Really would welcome people to type in their questions, clarifications on that. We'll be monitoring that and lining up questions to bring back to the panel. So please type in on that, and I'll keep an eye on that. That's what I'm looking at on that screen. That's where the questions will pop up. So I'm going to hand over to the panel now. The order of play is that the AKM participants are going to talk in order, following on from the presentation that Marc gave. So I'm going to start with Saleem, then hand over to Tinni, and then Hadi, and then Tripti to finish off. And then after that round of commentary from the panel, I'll be opening up to Q&A from the broader audience. So hold on, but start putting your questions in on the panel as we go along. Okay, so Saleem.
Thank you, Sam. So, and thank you, Marc, for providing a good overview of Corona Check. So I'm Saleem Sayani. I'm Director for Technology Innovation Support Center for Aga Khan University based in Karachi. So one of the challenges back in March and April was how to reach to population in countries where we serve quickly and without having these geographical limitations. So use of technology was no brainer. So we decided to use technology, and then we developed this app that Marc talked about. So this application is on both platforms, on Android and iOS. And it has 3 areas. So we were thinking what type of information that we need to provide to people so that it can help them, it can reduce their anxiety, and it can also help health system. And I'll talk briefly about that. So there were 3 verticals that we thought that we need to include in this application, and Marc briefly touched upon it. So one is a self-assessment tool. So people don't have to go to health system or to a testing facility to get themselves tested if they sneeze or if they have a fever. So they can go through this application and self-screening tool so that they can see whether they are at risk or not. So this is sort of a risk assessment tool based on artificial intelligence, and it responds to, so the way you respond to the question, it'll take you through a series of questions, and then at the end, it will tell you what category that you fall in. Second vertical was awareness section, which we believe that awareness was very important because there was a lot of unknown when back in time, and still now, people don't know what it is and what it is not, and how to practice physical distancing, for example. And then what about hygiene, best practices in hygiene. So we have these videos, and then we collaborated with respective ministries of health to translate those videos that they already had developed into local languages. So that is second vertical. Third vertical is availability of local emergency numbers within this application so that it is country specific. If you feel that you have emergency, you don't have to look for numbers elsewhere. There are emergency numbers for ambulances, hospitals, health clinics, hotline. Those are available within the system. Now, something that is really unique about this application is that we thought, well, there is a very limited segment of people who can read and write in English, as well as in their respective language, local language. But there is a vast majority of people who cannot read or write even local language. So how to cater to that population? Because they have access to cell phone, but they cannot read or write properly. So we have this audio feature here. So if with a click of a button, this entire questionnaire is translated into audio, and then based on the way you respond, it takes you through a series of questions, and then it'll put you in one of those 3 categories. So the idea is to actually reduce burden on health system during this time of pandemic, so that we can utilize and invest resources where we need to invest, that is critically ill patients, and strengthen the health system. So we are in Tajikistan, Pakistan, Kenya, Tanzania right now. Plan is to implement this in Mozambique, Afghanistan, and Syria as well. Thank you.
Thank you, Saleem. Okay, over to Tinni to talk about the India experience.
Thank you so much, Sam and Marc. Thank you for that overview. So I think here in India, one thing that emerged very soon in the COVID-19 situation was, for us being a community-centered organization, we've always been very close to our communities. Access to those communities was never ever considered a challenge. But the COVID-19 situation and the physical distancing and the fact that areas were closed, there was a lockdown in place, how could we actually reach our communities very soon? So that is how we needed to be nimble, we needed to be very quick, and that's why we decided to actually implement phone surveys, also to design and define our COVID-19 response. So very early in the COVID-19 pandemic situation, we launched our first phone survey, and that actually helped us identify what were community priorities, what was the community going through, and how then should be our response. while we had, as Marc mentioned in the presentation, while we had used digital platforms earlier in the past, that was primarily for data analysis, visualization, and actually to develop dashboards which could inform decision making. In the COVID-19, the strategy changed to actually use phone and digital platforms for data collection to help us input into our work. So I think that was one of the key changes that we made. Also, the timeliness, we needed to get that data really quickly because we needed to respond to community needs. And that is how mobile phone surveys helped us in ensuring timeliness of data collection and timeliness of our response as well. So I think that was a key learning. Initially, as Marc mentioned in the presentation, our phone survey did have some open-ended questions because we wanted to understand what community perceptions were. We found that very difficult to analyze. There were quite a large number of open-ended questions. While they did help us, but the analysis was made difficult. So in subsequent rounds, we limited the number of these open-ended questions. We also then used a tool rather than a survey format. And we did have our cadre at the village level who actually then went into the communities and implemented that digital tool to collect information. So that was then used as a tracking. The initial survey helped us design our interventions, and then to track the results of those interventions, we used a digital tool subsequently. So I think the benefits of this change have been the timeliness, the fact that it was very nimble. It enabled us to reach out to the communities at a time when they really needed support and assistance, and also helped us, how can we actually respond to community needs better. So I think that was the real benefit and the timeliness of the work that we were able to do. Looking back, there have been some limitations of phone surveys. One is that in the sample that we collected, were we really representative? Because it was limited to those who had phones. There are households, although the penetration of mobile phones in our country is really strong, and a large number of people in the communities do have mobile phones, but still there are some households that do not have access to a mobile phone. And also within those households, who actually holds the phone? It is the male head of household. So on some aspects where we needed to reach out to women specifically, we did find that to be a challenge. And therefore, in the subsequent surveys that we did have our community cadre actually reach out specifically to women. Since schools and ECD centers were closed, we also needed to understand what children were doing during this time, and therefore how could we reach out to children. So that was another challenge that we had faced during this process of doing these phone surveys. So that's been our learning. I think the adaptation has been to use digital platforms for timely data collection, allowing decisions to be made very soon and inform our work better in the field. If we had followed our traditional process of actually doing an evaluation, a survey, we would have lost valuable time. And in this situation, timeliness was of immense importance.
Thank you, Tinni. Great stuff. Handing over to Hadi now to talk about his experiences. Again, picking up on the points you just made, Tinni, and also Marc.
Oh, brilliant! Thank you, everyone, and thank you for laying out the context that we've all been working in so clearly. In the Tajik context, we had a very similar situation where, with lockdown being announced, we had whole valleys, we had whole districts that were completely shut off. That geography, roads were blocked, people were not allowed to access at all. And as an organization with a very large emergency response mandate, we found ourselves with the government being essentially blind in many ways and not having a good sense of where outbreaks were occurring, where people were in need, where gaps were in terms of PPE and medicines and medical equipment. and we needed to find ourselves in. We needed to identify and fix that gap very quickly. As an emergency response organization with a large background in that, we had nurtured this group of about 5,000 volunteers in Tajikistan, and across the region almost 20,000 volunteers, which had been trained rigorously over the years as volunteers within their communities to be able to do this kind of monitoring and responding to natural hazard events. So they understood the need, they understood how to give good data, and how to provide into a structure of response information that could be used for the actual responders. What this ended up being, though, was a tremendous opportunity. With us being able to expand the scope of that data collection, with us being able to bring in not only the community emergency response teams who are our primary responders, but having them linked to other volunteers, other villagers, and expand out this network, so that we had enough data coming in, and coming in through multiple channels, coming in through high frequency radio systems that led into our and the government's emergency response network, through WhatsApp boards that we set up very quickly, through interfaces directed to databases. All of these lines in that gave us an opportunity to triangulate, and in almost real time with the governments of the countries we were in, identify critical needs and be able to mobilize resources into very, very, very effectively. It was a game changer, and we're really looking forward to seeing how we build on that infrastructure. One of the really big learnings for us, though, was that in a context where you have citizen reporting in many ways, and you leverage extensively with donors and partners this group of resources, they come under inordinate amount of pressure from stakeholders who want to maximize the resources coming into communities, and finding ways for us to ring fence them and provide the space for them to make sure that the data that they give is as honest and accurate as it can be, and that they have the protection as individuals and resources to be able to feed in and feel like they're a part of the process. This has actually been a big change for us, and we're seeing how by enabling them and by engaging them in this process, there's been so much more buy-in to a whole set of activities that we do. So because communities have seen that when they engage, when they support, when they are part of the response apparatus, needs are met quickly. They are actively responded to, and they have a voice in the process. We have actually been able to significantly see the increase in their participation in not just this response, but in all of the activities we're doing, and we're looking to continue to build on that. So a tremendous, a great experience, and we're seeing the value, and we're seeing how we extend this into further activities for the future. Thank you.
Hadi, thank you, and yeah, great to get sort of some real life examples there of the impact in your country. Okay, finally, last but not least, Tripti in India. Can you talk about the 60 decibels experience and build again on what Marc has said? Over to you, Tripti.
Thanks, Sam and Marc, for introducing 60 decibels. So for the past 6 years, we as an organization have heavily invested in phone-based surveys to gather high quality feedback and social performance data. And our belief really has been that when done correctly, phone-based surveys can get high quality customer data at a fraction of the cost of traditional in-person surveys. So when 6 months ago, the world was hit by the pandemic, and nearly every country and society around the world began to practice social distancing and placing restrictions on travel and face-to-face interaction, the need for phone-based surveying became more critical than before. And we knew from our experience, having done this for so long, that low-income customer voices were likely not being heard in the many online surveys that were being initially conducted in the early days of the pandemic to learn more about the impact of, the impact that was being experienced by people around the world. And we really wanted to fill that gap. We mobilized our resources and started gathering data that measured changes in things like food consumption, impacts on people's overall financial situation, and real evidence of behaviors that indicate hardship. For example, how do people, how have people changed their saving? How do they spend their savings, or how are they selling assets to cope with the financial hardships of the pandemic? And really, in terms of our experience, even though our remote serving infrastructure was strong, we too had to pivot in order to provide timely data, which was much needed to inform targeted action. Like Tinni was giving examples of how important, the timeliness of data was in terms of coming up with targeted responses, especially data that gathered the experience and impact of the pandemic on those who were hit the hardest. The frequency with which we are gathering data is much higher than we have done ever before in the past. We're working on longer duration, multi-country engagement with clients so that we can identify trends and be first to inform where things are getting worse or better over time. And we're also sharing this data in public-facing dashboards in the hope that it can support more people to navigate and respond to this crisis. And the response from our clients has been very, very positive. We've heard from our clients that this routine engagement process and real-time data is helping them track the impact of the pandemic and equip those who are looking to respond. Companies whose customers we have surveyed mentioned that some of the insights they got from the data were reaffirming efforts that they were already involved in. For example, a company mentioned that it was great to find out that customers felt that company communication during the pandemic was sufficient, something that they were particularly worried about. Another company mentioned to us that this is an energy service provider in India, that they were able to identify and reach out the worst affected customers based on the surveys that we had conducted and offer payment deferrals and other financial support packages in the immediate run. Another partner mentioned that these surveys were helping them prepare precise and community-centric strategies in delivering their programs to the last mile. And we've also seen investors rallying around to provide relief funds that focus on subsidizing costs for customers because they now have access to customer data, recent customer data. And I think the one last thing that I'd like to mention, something that I've seen underpin other panelist presentations also, is that we've seen players in the industry come together like never before. I think it's safe to say that the scale and scope of the COVID-related impact data that we've been able to share with the world would have been limited without coordinated efforts from multiple stakeholders. For example, in the energy sector, we've had some of the biggest institutional and fund level investors not only support data collection for their clients, but also then share the results with the public for others to use. So yeah, I think the collaboration at various levels has been heartening to see so far. And as the world continues to adapt, we hope to see this kind of collaboration be sustained.
Thank you so much, Tripti. And hopefully we'll pick up on that collaboration point. I think it's a really useful area of discussion as we move on into the Q&A and discussion. So that's the panel. Really appreciate your comments and observations around the topic. And I think that's lined up for a great Q&A session, which we're about to go into now. I can see that there's been a number of questions coming in already, which is great. My job is trying to mediate them and pick on some of the key ones that can facilitate the conversation. So I'm going to do that, but keep them coming, and we'll try and make sure we cover most of them, if not all directly online as they come in. So I've seen actually one of the first questions that came in was one I wanted to sort of tee up the panel to. Some of you have talked to it a little bit, but it'd be good to get a bit more depth. Really, as we all know, that the point of collecting data and conducting evaluation work is to inform programs and to help improve programs. So I suppose the question I have for the panel, are there concrete examples of how this new data, this new improved monitoring evaluation data that's being produced has actually resulted in course correction or pivoting around programs? I know some of you talked to that directly, but I think it'd be good to get some concrete examples to to talk to. So my proposition is I will go through the same order of panel as before, and if you have things to add, that's fine. If not, just pass on. So Saleem, lining up you.
Thank you, Sam. So we started this Corona check, and I'll be talking about Corona check. So we don't have enough data right now as we are moving into data collection and then we are gathering data. But initial data that we have, it suggests that we need to change how we provide awareness to our audience, to our population. And we have received some phenomenal suggestions through our App Store and in iOS, and we are implementing those suggestions. But overall, I see a great potential to impact policy once we have enough data to make those changes and those recommendations.
Thank you. Tinni?
So I think some of the things that came up during our initial surveys and which allowed us to immediately respond was that because the schools and the ECD centers were closed, children were spending their time at home, and there were little activities that they could do. So we actually intervened by actually developing posters on parenting approaches, and we disseminated these posters on WhatsApp, and that was very successful. So it was like every day a parent would get a WhatsApp poster relevant to the age group of the child, which would actually support parenting or small games or small activities that parents could do with their children while they were at home. And these were very simple posters, very easy to understand, using a lot of pictures. So we moved our early childhood development approaches to posters which were disseminated very widely through WhatsApp. So I think that was one change that we made, which emerged from the phone surveys and the information that parents and caregivers told us that, they were finding it difficult to find, stimulating activities for children, given that the schools and ECD centers were closed. Another thing that emerged was that while the government had announced a fairly large number of entitlements, information around those entitlements was very limited in the communities. So we immediately started messaging. We also had a vehicle that went around villages telling people of the government entitlements and the process that they could actually enlist and benefit from these entitlements. So whether there were food rations, whether there were direct benefit transfer of money to the really poor, whether there was old age support. So we did a lot of work around information dissemination on these entitlements. Access to basic PPE for frontline workers also emerged as a need from our initial surveys. And in fact, one of the first interventions that we did in very close partnership with the district administration was the distribution of a basic PPE like face masks, gloves, hand sanitizers to frontline workers so that they could continue to do their work. So I think the initial surveys really helped us respond to community needs that were emerging. Food rations, access to food rations for the most vulnerable was also a need. So women self-help groups that we support under other programs actually started grain banks, where there was a certain amount of grain that they could actually distribute to the most vulnerable in their communities. So I think there were a variety of activities that were informed by the information that we got through these initial surveys.
Great, thanks. Hadi, any comments on course correction based on the data?
I think we actually had a very interesting example of a course correction that we needed to take based on the fact that we did have access to good information. One of the things that we had done with the government of Tajikistan is we developed an emergency humanitarian response framework, and in that framework we had a number of key activities such as ensuring that there were supplies to disinfect health facilities and other key infrastructure. What we found was yes, that those activities were continuing apace, but through our monitoring network of volunteers, we started identifying that we had spikes in waterborne disease across different areas, which hadn't been the case before. And it gave us the ability to actually almost in real time be able to understand, okay, what is happening is that chlorination stocks that were conventionally used for water supply were now being diverted for disinfection. And we were able to put in place very quickly mechanisms to ensure that there were enough stocks for both programming. But very, very real, very, very life-saving activities that could be undertaken because we did have access to that good information. Thanks.
Thank you, that's great. And finally, Tripti.
Thanks, Sam. I think I shared some examples on how companies have been using data to inform their action. The one thing that I'd like to add to this is we've observed how keen companies are to use customer feedback to inform COVID responses, mainly because they have limited resources and they really do want the response to be targeted to the most vulnerable. And the data that we're gathering allows them to identify, based on people's customer profile, their financial resilience and the coping mechanisms they're able to use, based on where they are in different parts of the world, and how much access they have to relief, that people are more keen than they have ever been before to use data and have data-driven decisions inform their action. Yeah.
Great stuff, thank you. Yeah, I think there's many more examples as they come up, and a lot of the data, we're still early days, so as the data's coming in, how that course question plays out will be, I think, a key area of research for all of us as we move forward. Okay, we've got lots of questions coming in. Obviously, we can't answer them all, but as an important one, I think, that's come up on data privacy and how this technology manages or adapts around that. I'm not going to ask the whole panel to talk to that, but I think there's a couple of you have already flagged that you can specifically talk about it. In the UK, those that you may know, there was a big hoo-ha because we were going to develop a world-beating app to help us prevent people, catch people with data, finding out who's been in contact with who. That app in the end didn't work, and mainly because of data privacy issues. So it's a very pertinent issue, I think, across the globe, and it'd be good to get people to talk about how you guys have addressed that with your particular technologies. Saleem, I'm going to ask you to go first, and then maybe Tripti, then Tinni and Tripti.
Yeah, thank you, Sam. So it's a very, very important question. And when we talk about data privacy, what is really important is to understand what is the mindset of a consumer. And we need to understand that if the element of trust is there, then there are no issues and people will share their data. So how do we develop that element of trust? And one thing that we found is that be transparent, be very open from the day one, and what type of data you're collecting, why you're collecting this data, and how you're going to use that data. So with Corona Check, what we had done is we have this data privacy policy that people can read, and then we articulate everything that, well, this is what it is and this is what it would do, and this is the type of data that we are going to share. And people can opt in or opt out. So if you agree, then only you can move forward with this intervention. Now, also, something very important here is that there are two types of data that usually we collect. One is personal information that we collect through these data collection tools. And the other one is just the numerical data, which is anonymous data. So in Corona Check, what we've done is that to avoid this complication, we only collect numeric data so that it helps us make informed decision in the future based on the trend that we see in each country. We don't collect any individual data, for example, any phone numbers, any name or anything else. So there's no personal data, personal information that we collect just to avoid that. And we learn from countries such as UK that how it can become very problematic when you collect personal data, because then there's data ownership issue, then there's the data security issue, and then so many other issues. So what our intent is to focus on policy and how we can have a policy that is well informed based on the data that we have. And for that, we really believe that we did not have to collect personal information at this point for our application.
Thank you, Saleem. Tinni, do you want to talk to the example of in how you've done that with the phone survey?
Yeah, so in our case, I mean, the phone survey actually starts with an introduction on what the survey is about and whether the respondent would like to continue with the survey or not. So there is some sort of agreement on the fact that, you know, the person would like to continue with that. So similar to when we do in-person surveys, we have followed the same protocol in this case as well. So when we call, we actually ask and explain what this survey is about, what is the type of questions that will be asked, and get the person's agreement whether they would like to continue or not. In our case also, because the phone surveys were being carried out with communities that we have had a long history of working with. So that's how we also had their mobile numbers, because there are many programs with which we work with them. So in that case, it was also, they were aware about our work and they knew that we were doing this phone survey because we couldn't actually come into their communities the way we used to. Our staff couldn't visit, our team members could not visit. So that was the reason why. So we had a very, I'd say it was a very positive manner in which these surveys were conducted. But of course, given that there were some limitations, I mean, were we able to reach the most vulnerable? That's why we changed strategy and actually had our team members visit villages following all the protocols to really reach out then to the most vulnerable, those who did not have phones and therefore were not covered by the initial survey.
Thank you. And finally, on this particular question, Tripti, I think the work that you guys have done would be, if we could talk about that, how you've addressed data privacy issues.
Thanks, Sam. And given that we do remote surveying, you know, through the year and have been doing so even prior to the pandemic, we've been very careful about how we address these issues in the entire process. And so this is not specific to what we've done during the pandemic, but in general, our approach is such that we make sure that we have permission to contact the respondents. We get contact details from the companies, the social enterprises, organizations that guarantee that, you know, they have permission to share contact details with us. Even after that, we make sure that, like Tinni mentioned, when we do call the respondent, we first explain to them the purpose of the survey. Second, seek permission to continue the survey. So there's an opportunity after they fully understand what the purpose of the survey is to still opt out of the interview. And additionally, we offer anonymity. And actually, in the case of pandemic, it was, we didn't even ask because we were asking very sensitive questions and we thought we would get more honest and comprehensive answers if people felt safe answering those questions. And so offering anonymity is important. And lastly, most of the time we share data on an aggregate basis. So we're trying to draw insights, and we don't necessarily need, we don't believe that individual responses with you know, personal information are necessary for the company and other stakeholders to inform decision unless they request for that information, and then we check if this individual was all right with us sharing information. We try to keep you know, results to an aggregate basis. So it's very important, and we try to make sure that we take care of this from the start of the process to the end. And I think this is the bare minimum we can do in ensuring respondents feel safe and secure in sharing information.
Thank you, Tripti. And I think that the response you gave there sort of lines up my next question, which again has come up from a few of the questions from the audience. You know, I suppose the point you're making around data privacy is that in many ways this is accentuating problems or issues that have always been there in data collection. And I suppose that's a similar issue around how you know, a lot of the challenges we're facing with COVID-19 is really accentuating issues that we're already there in terms of how you do good monitoring, evaluation, and reporting. And so that's I think where my next question goes. A few of the audience have flagged, you know, what are the practical solutions to how how ensure representation and a good sample when we're collecting this data. So people have mentioned, you know, how do we get adolescents, hard to reach populations, people with physical disabilities, people in rural areas which maybe don't have access to mobile technology. What's our approaches and solutions to that? I guess all of the panel will have something to say around that, and some of you have already flagged some of those issues already. So we'll start again with, as we have before, with Saleem.
Thank you, Sam. So very good question. In Pakistan, what we are planning to do is we have a huge network of volunteers, as Hadi mentioned, and in Tajikistan as well. So there's a huge network of volunteers within Khan Health Services that we are planning to mobilize, and also a workforce that is partially government paid and partially AKHS paid, that is lady health workers. So we are planning to utilize these workforces and these group of volunteers to go in the field, which they do normally, and use this application and provide opportunity to people who don't have access to mobile phone to run through this questionnaire and run through this self-assessment, so that they can take advantage and we can actually cover that hard to reach population.
Thank you. Tinni?
Yeah, so just I think linked to what Saleem just mentioned, I think a mix of both processes. Like one is the more distant phone survey where you're not really interacting with the respondent, and then to actually physically go there and meet the respondent following all the COVID-19 protocols. So we've now moved to a mix of that, specifically because we realized very early on in the phone surveys that perhaps we were not reaching women. We really wanted to reach women to find out whether things like access to food and all of that was available. There were a large number of entitlements that had been announced by the government specifically for women, whether they had information around that. So reaching women was a key priority for us. And that is when we felt that perhaps we need to activate the community platforms that we have. So we have a large number of women self-help groups. We have community cadre, whether these are our community-based women paravets that are in these villages. So it was that community cadre that we then activated and had them actually following all protocols, meet with the most vulnerable, specifically reach out to women, and also meet with children to find out what were they doing during this time. So we then moved to a mix of both approaches, not just the phone survey and not just the in-person, but a mix of that, so that we could reach out to all households in that in our geographies, and also specifically within the household, whether we could reach, say, adolescent girls, for example. We have a large program on empowering adolescent girls who were not then able to visit the centers where they are provided training, and many of them they are provided scholastic support. So did they have access to phones to have online classes? We needed to know that. Or would it be better for us to actually develop worksheets that they could then pick up and practice those at home? So we followed then a mix of those approaches.
Tinni, that's great. Thank you. Lovely. Hadi?
I think Tinni and Saleem have so eloquently spoken to the fact that we have these civil society groups already on the ground in many of these areas. Just to continue to build on that, with the volunteers that we leverage, these emergency response teams are both men and women in all of the countries that we work in. So we ensure that the data that we're collecting from these teams on the ground in communities in the most remote and rural areas are representative of those communities, and also have been trained on how to engage and ensure that they are incorporating in people with special needs and people who are particularly vulnerable in those communities. So there's we have this great opportunity for triangulation across health activities, health services, across the civil society groups, and the emergency response networks that we leverage. And with that, we get this great, rich tapestry of data that we can use across the board. Thank you.
Great, and Tripti.
Thanks, Sam. I think the only thing I'd add to that is that we work within the framework of the customer base that our clients share with us, and so our goal really is to make sure that our sample is representative of the population their customer base is made up of, and so we try to randomly sample as many people as we can from the customer base that they share to make sure that the sample is representative. Sometimes, we've learned that actually stratified sampling, focusing on certain sects within their larger population base, ends up being more important. For example, if there is a specific relief measure that is targeted towards women, we would try to sample that group as opposed to the entire population base. And so I think the difference here is that we try to mirror what the customer base looks like for the client, and so that we can share data that's representative of that base as opposed to targeting one specific group unless specifically requested for.
Thanks, Tripti. You're a little bit quiet there, but I think we caught what you got. So maybe get the speaker next to your mouth next time. Good. We're running short of time. I've got a penultimate question, which is which has come up from a few of you on from the audience around the question about how you get the data. So how do you? I mean, a lot of you have mentioned volunteerism. The fact you've got a suite of volunteers that are engaged. A couple of questions have come up around do you donate mobile phones? How do you get more encourage and facilitate and leverage more engagement from the populations that you're collecting this primary data from? And related to that, an ongoing question that often comes back is how extractive are these processes? So to what extent are we able to feed back the findings to the populations we're working with and make sure that this is not just getting the data from them and taking it elsewhere and using it for other means. So if the panel can talk to those two questions, I think that would be a great way to sort of line up the final question. I do apologize in terms of questions that come in. I think we picked up most of the various streams that have come up, but if we have time, I'll try and fit one more in, but I've got one more question to line up to the conclusion. So my guess again that all the panel would want to speak a little bit to that question I just asked. So again, I apologize. I've stuck with the same group order each time, but I'm going to do the same. Saleem. You're not on speaker.
Sorry. So yeah, so feedback loop is really very important, and it is important for us to ensure that people who are providing information, they get to know what are we doing with this information or data that we are collecting. And I'll give you an example. We got a lot of feedback from our users, user community, when they were downloading this app through Android and iOS platforms. And there were some great suggestions based on that. We actually improved our application, be it the functionality, be it the presentation. And sometimes it was a good opportunity for us to create awareness why we are doing the way we are doing it. So we provided that response back to the community, and then it actually helped a lot in A, understanding their perception, and B, providing them the feedback about the process and about the reasoning behind what we were doing. So very helpful.
Thank you, Tinni.
So I'll respond to that by actually giving a concrete example. So the first time when we did the Lean Data Survey, and Tripti is here, we had actually done it for a program that is Women's Empowerment Program. And of course, all the data was anonymous and all of that, but some of the findings were so meaningful that we actually had a presentation with the same people who'd actually provided that data. And it was remarkable to see how they interpreted that information. And some of the responses to the question, some of the challenges that they faced, they were also able to start discussing solutions themselves. So I think it's a very important step to actually take back the data to those who have provided it in the first place, because that also gives you solutions. So again, another concrete example, say the WhatsApp posters that we developed around early childhood development, there was a lot of tweaking that we had to do because parents said, no, this is not, we won't ever use, we can't use this kind of game. So we had to actually have a constant back and forth with the community in terms of designing and refining those. So it's also because we have our community cadre at the ground level, we are able to have this very strong connect. We have a large number of community institutions in the areas and the geographies that we work in, who also help in providing that feedback. But I think it's a very important step and something that we need to ensure across our data collection. It should not be just that extractive, because it also helps us develop solutions. Once the community is able to understand the problem, the solution will also come from them. And that's the solution that will then sustain and be implemented also.
Great. That's almost a concluding point, so thank you very much. Hadi.
I think just to again reiterate, for us during this emergency, the context of the volunteers, the resources that we used from these communities, they've been heroes to this. They've been the saviors of their own communities. They've been the ones that have ensured that critical supplies, critical lifelines, critical decisions were made to enable their communities, their families' ability to make it through this difficult time. And what we've done is we have ensured that recognition of their support, their engagement, their contribution to their own betterment has been widely accepted, has been broadcasted on social media, on national media. There's been a wide recognition. We've gone so far as to have the international community issue with the government reflections of that good work. So their continued engagement, their understanding of where they fit into the process has been really successful, and they feel really motivated. There's a constant wish for them to continue to provide that support. And what we do is we are not only recognizing their recognition, their support, but we are also ensuring that the impact of whatever they do is fed back to them on a regular basis. So it's this dialogue loop, this communication loop, this ability to feedback and have everyone on the same page as to how important their contributions have been, has been one of the learnings and one of the real successes of this really difficult time.
And finally, Tripti.
Thanks, Sam. I think for us, absolutely right. We don't believe that it should just be data collection should be as just an extractive process. But instead of us sharing findings with the respondents, we encourage the organizations, like Tilly mentioned, we actually encourage the organizations we work with to share and close the feedback loop. And so one example that Tinni gave was, fabulous, but the others have been, people sharing findings via WhatsApp messages with their entire customer base saying, look, we've heard that these are your top 3 challenges. We as an organization are looking into it. And so the idea that the respondent knew that there was a purpose of the questionnaire, and that purpose is now being met by the company, or at least being attempted to look into, is really important. And so instead of us doing it, we encourage the organizations we work with to do it. And we've seen that happen very, very often. sometimes during that process, there's a level of engagement that sheds more light into the challenges. So, people get more encouraged to share things that they may not have shared with us to begin with. And so we aren't part of that process, but we encourage the organizations we work with to be, part of that.
Thank you, Tripti. Okay, so I think we are nearing the close of our session. I've got one more question that I want to ask the panelists, and then we'll hand over to Marc for some final reflections before I close. So my last question, of course, is looking forward. And as we all know, across the globe, there's significant concerns about a second wave, or what we may call the continuation of the first wave. Things are going to be rough for some time looking forward. So my question really is, what do you think the key challenges are, and how are we continuing to pivot and adapt around that? What are you guys doing, looking forward and preparing for the future, not just the immediate future, but the long term, when we build on this? So I am going to go in a different order now, because I feel we need to shake things up again. So I'm going to ask Tripti to go straight ahead and comment on that, and then and work backwards.
Thanks, Sam. I think for us, our experience with the level of collaboration that we've seen has just been so phenomenal. That's the one thing that we're hoping to see continue. We want to continue working with and find more partners who can fund longer term research to track and understand change and impact. We know that for the most vulnerable, the recovery period will not be short, and we're going to be in this for the long haul. I recently read a report that said the pandemic is reversing decades of progress that have been made in terms of several development goals. And so I think we want to be involved in the capacity that we are in at this point, but we also want to encourage people to partner with us in these longer term engagements that we've seen happen in the last 5 or 6 months. As an organization, we'll continue to strengthen our remote serving infrastructure. We currently have about 330 enumerators around the world, I believe in 35 to 40 countries. We want to expand that so we can reach more regions that we're not able to reach right now. And I think one of the last things that I'd like to mention is that we've put together a remote survey toolkit for the public, for social enterprises and other organizations to use some of the technologies and methods that we are able to use to do remote serving. It includes a guide to help people get started with phone-based surveys, as well as a vetted list of remote survey providers. And so I think we want to be involved in this process as much as we can, but we also want to continue, educating others, other stakeholders in how remote serving can be conducted during these difficult times. And and I think the one last thing that I'd love to mention is that our team has been privileged to, be in this situation that has allowed us to really, leverage the kind of work we do. But we recognize that there have been organizations who have focused primarily on in-person interviews for the longest times and traditional M&E. And so we want to be a support network for them as well. And so, we're only going to get through this together, and we hope to, be there.
Thank you, Tripti. Hadi.
Oh no, thank you. For us, one of the key challenges that we are anticipating is currently one of the key strengths, which is that right now we've been able to use these volunteer networks, have them see the impact of their work almost immediately, in that we're able to translate their needs, gap identification, into resourcing and into programming and into activities. What we see, though, as a challenge going forward is that as resources start depleting, this will be a prolonged emergency. This won't be something that we get through over the next short period of time. Resources will become more and more scarce, and the ability for us to continue to have those communities see the impact of their interventions almost in real time, with us being able to provide support through government and through other partners, that'll diminish. That may potentially diminish. And what we're doing to try to pivot around that, what we are trying to do and to try to get in front of that, is really be able to reflect back to governments, to donors, to partners, that because of this richness of data, because of this richness of information, because of this ability for us to capture knowledge, information real time, donors and partners can in real time see that impact, and that'll be a continued motivation for them to be able to support. Where there is data, where there is knowledge, where there is information, where there is an opportunity to see the full picture, we hope to continue to leverage that with this base to be able to translate that into resources for these at-risk communities. Thank you.
Thank you, Hadi. Tinni?
Thanks, Sam. I think what we've seen over these last few months is the power of timely data collection and how that can become a very a positive loop to actually inform interventions, and then based on that actually also empower communities to take decisions. I mean, what we've seen here is that a lot of communities have actually come forward themselves. The first support was actually provided to the poorest by communities themselves. And I think that's also something that this pandemic has taught us, and perhaps what we should support much more through our data collection. So timeliness is, I think, the very important learning, and the power of timely data collection, timely decision making, and timely sharing back with the community. So I think the nimbleness of M&E is what this pandemic has taught us. I mean, M&E will have to be nimble going forward, because that is what is required. I mean, we could face another problem tomorrow. How do we use our existing data collection platforms to actually respond as soon as we can?
Great stuff, Tinni. Saleem?
Thank you, Sam. So now I know the pain of going last. So because what I wanted to share, everyone already has shared. So Tripti, I feel your pain. So as it was mentioned earlier, and I think it was Tripti, you said that we have gone back on our sustainable development goals due to this pandemic. So you're right, but there are two SDGs that we have made tremendous progress just because of this pandemic, and that is SDG 9, which is innovation, and SDG 17, that is partnerships and collaboration. So I have never seen such an uptake in innovation and digital technologies that I've seen during this pandemic, and I've never seen such willingness of collaboration in international partners that I've seen during this pandemic. So that is great to see. Working with the ministries of health in our respective region where we operate, what we have done is that we have created this collaboration with them, that we have this data. Let's see how we can get ready and then prepare ourselves better to respond to this pandemic if next wave comes. So, well, it is not if, it is just when. It is going to come, but we need to be ready, and then when it comes, we should be ready. So that is one area, and then we can use this technology, and sometimes we think it is either or solution. So either it is technology or no technology. But what pandemic has taught us that we can have a hybrid model where we can have technology, we can have a solution for people who are not, who don't have that literacy in terms of technology. And we can have that hybrid model working with the workforce that Hadi mentioned earlier, the volunteers and then the community health workers in the field. We can reach to hard to reach people, and also we can serve the country and then in their effort to actually be ready for this next phase.
Thank you, Saleem, and thanks to the panel for managing all those questions so expertly. And before I hand over to Marc to close, because he started the presentation, a couple of comments from my perspective. I found both the session and the questions and answers overall very optimistic. I think it's a really important to flag how the evaluation community has really, like many other communities, mobilised around the response and leveraged address many of the issues that we have been addressing for some time to try and help improve our response both globally and nationally, and you know, from what I've heard from today, locally. So really think it's not optimistic. Certainly from ITAD's perspective, we've been facing the same challenge, and every evaluation house around the world has been doing the same thing. We've had these issues that we know that they're, we've had to mobilise and pivot very quickly to do that. And I've really enjoyed hearing the reflections and thoughts from this panel. I'm going to hand over to Marc to close, but also want to thank the facilitators and the participants. Really good questions that came through that made this session as I think as interesting, as engaging as it was. So thanks to everyone that's been following and listening and typing their questions in, and thanks again to the panel. Marc, over to you to close.
Yeah, just to briefly echo your thanks. I think it's been a really interesting session. Sam, thanks for moderating. Panelists, great perspectives and points, and the audience have really engaged really well. Thank you so much. And I would also mirror your thoughts, Sam, that it's been an optimistic session. I think some of the key things that have come across to me very strongly from the panelists and from the audience are that an appropriate M&E system that uses an effective rapid feedback loops to decision makers can really generate very kind of concrete solutions for communities. So a very vivid example of that was Tinni's example of the posters being sent out to parents using WhatsApp. That's a very kind of vivid application of a rapid feedback loop that I think that led to very practical kind of solutions. Another kind of theme that I thought was really interesting was this idea of ensuring that that rapid feedback loops weren't a kind of extractive process, that it's really important to engage community members through a full kind of feedback cycle. And that both allows a much greater kind of engagement with communities that leads to greater participation and leads to kind of a more effective kind of collaboration with community members and partners. However, you know, all of the innovations that our panelists have talked about with regard to M&E, things like telephone interviews and apps, etc., are not a panacea. One of the things that came across clearly is that ensuring representativity is difficult using these new technologies and using these new methods and approaches. And some of the suggestions I thought were really practical and helpful. So, for instance, one of the suggestions was that it's really important to use kind of community mobilizers to go out to communities and really engage people that may be marginalized or not easy to access through these technologies and these methods. So it's important to have some human contact with people that have experience in communities to ensure that people are not left out from research processes. And secondly, that it's really important, whether you're using community monitors as volunteers or you know, in terms of kind of the research team involved in data collection, that you have a good balance of gender and other kind of variables to ensure that you're capturing the perspectives of all of the population. There was a really interesting discussion, I think, around the importance of privacy, and some of the key things that came out from that were that it's really important to be transparent with our clients and with our respondents. It's really important to avoid collecting data on an individual basis, and that it's really important to go through a proper consent process. And I think kind of looking forwards, I think some of the really interesting and clear kind of messages that came out was that organizations such as 60 Decibels really see themselves as being providing a support for other people that may be wanting to adopt you know, innovative approaches to data collection. That in the case of organizations like AKA, that they're really seeing the benefits of generating rich data in real time, because it allows them to engage with donors and other actors to demonstrate that they can really understand the evolving impact of change over time. And that's really powerful kind of effect and outcome of this process. And I think that Tinni very strongly spoke to the importance of timely data, which is not extractive, that it's fed back to decision makers and also key community members. And I think that what I found really interesting about Tinni's point was that allows for much better solutions to be generated, which are more sustainable and can be implemented over a sustained process. And I think the really optimistic conclusion from Saleem was that, we've gone through an unprecedented process of acceleration of innovation and sharing and collaboration. And that really hopefully provides a very strong and robust platform for a second wave or a continuation of the first wave. So I'll just stop there, Sam, but just again to say a big thank you to everybody.
Great, thank you, Mark and the panelists again. And I'm going to pass over to Connie from the conference to close the session. So from our side, our job is done. Thank you. Have a great rest of the morning, evening, night, day for all of you around the world.